Hi, Nick and Eli. Guys are there.
Hi, Carol.
How are you?
I'm fine. How's things with you?
Yeah, busy, but they're okay, thank you. As long as the nurseries don't close, I think we will survive. But
okay.
if
They're not closed.
The nurseries aren't closed, or at least in England, they're not closed. So it's just the schools, just the schools are closed. So.
Are your kids at the university nursery then?
No, so my it's Clodagh out of school. She's in the first year of school, so she's yeah, she's 4.5 now. So time flies. It's been
they start early in England as well. I mean, in Scotland you start a year later, basically.
Do you? Okay. Well, I mean, technically, legally she doesn't have to start school until her birthday this summer, but typically they start early. So. But yeah, the youngest he's at a local nursery, but they haven't shut, thankfully. I'm not sure if the university nursery is still open. That might have shut. So I don't know who else is going to come. Valerie said she can't make it. So Sean said about moving this to 4 p.m. Does that work for you guys?
Yeah. Hang on.
So an hour later.
Doesn't matter to me.
11. Generally speaking, that would be fine for me.
Cool. So I spoke to Flavio last week because he said he was going to work on was that right? He was working on the bit you started writing.
Yeah, and I think so I saw he started a version with his initials, but I didn't see any comments, and we've got a bit of an issue that there's like forked versions that are not, we've forked, and there's a little bit of this going on. Because there's the version that Jay rewrote that incorporated, I think, Nick's comments, and I think Dave Finoff's comments, but then I'm not sure which version Flavio's working from.
Okay. Need to check. Okay.
And I looked at the version Jay wrote and added a few comments on top of it, but I think it's at a state where maybe you don't need to edit, but maybe you need to skim it and provide us with some bounds.
Yeah.
Because I think this is the challenge is we've got, I don't know. Well, I guess we've got 2 papers getting written at the moment that need to get merged. But I think we're supposed to be having like 4 papers getting written that need to I don't know where the other 2 are.
So I'm not sure whether Camille is going to contribute. I mean, I guess it doesn't matter if we've got quite a lot from these 2 sections. Because I did ask him and he just said he's been very busy with homeschooling and he's not sure he's going to be able to have the time. And then I think David he still wanted to do the prevention section. So I guess I just need to follow up with him on where he is at with that.
I mean, that shouldn't take him very long, Kira, because he's already kind of written a paper on that whole issue. So I guess he could just summarize it or something. And I don't know if other people would need to feed into that writing or not. And what's your deadline?
End of March. Ideally.
So, I mean, I think it would be helpful. I don't know, Nick, you know Dave pretty well as well, but I think it would be helpful if we started going ahead and figured out how the cost benefit and behavior papers sort of fit together, and provide Dave like a very, like, write this here space, I think might be helpful on the preventive side of it.
I guess logically, Eli, the prevention bit would come last because it would probably make use of quite a few of the ideas that you already develop in your section, and
Yeah,
maybe some of the cost benefit ideas as well. So I think logically that would be the last thing that would be in there.
right. So so I just gave a talk earlier this week on behavior in infectious disease models, and so I was also thinking a bit about what we've been doing. But I need to think back about I would need to look back at the benefit costs to see where it's at. But I think one of the interesting challenges for Dave and prevention is if we do sort of static benefit cost or return on investment, and how you deal with discount rates and some of these other issues that I think are in the benefit cost paper, right? The benefit cost section.
Yeah.
Yeah. Okay.
Well, would it work if Eli kind of tries to somehow get a finalish version of his part, and then I try and think how that fits into the cost benefit part, and then we pass it over to Dave to, okay, here's where you feed in. Would that work, Eli, or does that sound infeasible to you?
It might work. I mean, I think it would be helpful. So it'd be helpful to get Flavio's comment. I mean, I got a general comment that was kind of like, everything seems like it's there, but I'm going to work on this. And then I'm not sure what happened. And I think, I mean, otherwise, I kind of feel like, having read through the version that Jay wrote, I think there were a few things that I would change, but again, some of it has to do with scope and has to do with how it's going to connect to something else. So I think it would be really helpful. It would be really helpful for me not to waste sort of energy going down the wrong direction if Kira at least skimmed the benefit cost and skimmed the behavior, like the Sjogren version of the behavior model. And I mean, the one with, you could skim the one with Flavio's initials too. They're similar. Jay just reorganized it a bit. And then maybe made a, like, this is how I see this all fitting together.
Okay.
Right. If that's right. And then, like, here's the bits that need to be developed. And oh, by the way, please now go iron out these wrinkles, or like, don't worry about, like, this is going to get cut anyway. Like, that's my concern, is I don't want to spend a lot of time doing stuff that Kira's going to be like, actually, we're going to cut this.
Yeah, that sounds good.
Yeah. Okay. That sounds.
I mean, all I did with the benefit cost bit, Eli, was just added more references. That was it.
Yeah, no, I skimmed it and it looked about the same as I had seen of in, I guess, the penultimate version there, or maybe this is the penultimate, the penultimate version relative to the current version. What's that, like the previous, like when it was getting circulated?
Yeah. Fine. So,
yeah.
Is it Kira's job to give Dave the heads up on what we want him to do, or do you and or I need to do that? Eli.
Oh, that was to me.
Yeah.
I mean, I don't know. Dave's pretty good. He just needs prodding sometimes, and I think that I also think these are hard to write because you're sort of writing stuff that you know is feeding in, and it's really easy with any of these topics to write like a mini book, and I think that, right, nobody wants to put that level of effort in and then have it all get cut down to one page. So I think that it would be helpful, again, if we kind of look at what we've got, look at how it's going to come together, and then say we want about literally like N pages or N sentences on this. And I think that will help Dave deal with that. I don't know if you guys saw, there was I saw a news article yesterday that apparently the US pandemic fund actually did exist. It was just not used for pandemic preparation, but for like buying new office furniture.
So apart from that amusing story.
Sorry, well, I was just thinking of like the preventive investment side of this, and that's what made me think of, like, you can have a policy of preventive investment, but
Yeah, it's hard to make sure don't spend it on sofas. Yeah. Okay, so what it sounds like then is Kira makes the next move. She basically integrates what Eli and his team have written with what I've written, and then maybe send it to me, Kira, and then we'll send it to Dave and say, okay, Dave, what we need is 2 pages, and it goes at the end here, and it needs to cover these 3-4 issues, whatever, and this is how it links to what we already have.
Sounds good.
Is that all right?
Yeah, that sounds good to me. And then I'll change the meeting invite as well, so it's 4 p.m. And then
We're
hopefully
not getting anyone else today.
No, I don't think so. So Sean is teaching, so he asked if it could be moved to 4, and Valerie can't make it.
Yeah.
So oh yeah, sorry.
Yeah. I was having a bit of a read through the drafts, and I thought had a couple of sort of rather general comments. I mean, one was that there's a bit that sort of sets up a sort of simple compartmental model as a sort of straw man, as you know, this is obviously not going to be good enough if you want to look at effects of interventions and details for cost benefit and so on. I just feel that there's some cross-referencing to the modeling paper could be a good idea, because the modeling papers has at a very fundamental level, one of the key points of trying to make there is that you can't have a single model. Well, a single model of the pandemic is going to be a bit like Lewis Carroll's map of the country at a scale of 1 mile to 1 mile. You have to that effectively trying to come up with answers to the scientific questions about a pandemic. That's what modeling should be doing. Requires having simple broad brush models, but which you acknowledge are not going to be able to help you with the details, and then having detailed models for looking at specific angles, like, for instance, looking at the economic interaction of economics and interventions or something. So I think that there's common ground there, is all I'm saying. And I suppose if they're really generic points, it may be better for them to be made in the modelling paper and to be referenced by this. But it could work both ways. The other thing was just to say that as a bit of sort of provocation, I've popped into the Dropbox a paragraph from the WHO Independent Panel Report on economic impact, which has a headline that says prioritizing health or prioritizing the economy has proved to be a false dichotomy. So, and that's taking a sort of positive spin on that. I'm sort of thinking that I think so much of the detail in practice has been about sort of big issues like trust and so on. That I suppose that what you would say that countries which have had effective strategies have sort of got the public on side, and so they're prepared to, I suppose, not think about or ignore their own economic advantage, disadvantage detail, and see a sort of bigger picture where someone has to decide whether you're going to have a lockdown, and if so, how long for, and you go along with that rather than trying to disrupt it, whatever. So yes, I mean, disentangling the economic detail and the behavioral detail is great, but somehow I wonder if I wonder if there's a danger of coming up with sort of detail that is sort of unrealistic in some way.
So that's really interesting, Dennis, because I've been in a meeting this week where there's been a number of talks on this topic.
Yeah.
And I find these, I think as a sort of casual observation, I agree with what you're saying. As an empirical modeling problem, the challenge is that that's like a non-measurable parameter that we have no equation of motion for.
Yeah.
And so what winds up happening is you get trust matters out of the models by assumption. Like it's really hard to write down those models at a level where you have like endogenous micro trust emerging or evolving. That's not just like, we're going to create this, like these two camps and they polarize and boom and voila. If we didn't have that, things would work. It's like, yeah, but that was just like assumed on line 2. And I think this is where economists get really frustrated with those models, is that there are great models in economics of sort of, you can have a utility specification where you care about other people. The problem is we don't actually, and there's nothing in economics that says you have to not have preferences over the well-being of other people. The problem is we don't have a great model of how those preferences emerge, evolve, and change. And I think this goes back to like, you know, the whole sort of Lynn Ostrom's work on institutions, and since Lynn's work, people have been trying to figure out, is there a foundational model for these ideas of trust or these ideas of reciprocity, and they don't exist. And what winds up happening is you wind up getting them glommed onto models where you can get a phenomenological description ex post, but they're completely irrelevant to the ex ante policy question. And that's like, I'd be interested. And so my concern about without having read the modeling paper and sort of knowing that these are big issues in like the epi modeling community, is like, let's put a trust parameter in here, or let's show that like trust matters. And it's like, well, yeah, but they're by assumption and they're by selection.
Yeah, no, I think I'm not trying to solve that insoluble problem. I suppose I'm more thinking that, yes, it makes sense to try and work through in detail what a sort of economic-minded, behaviorally minded strategy might be at a local level. But at some point, you've got to somehow package that at a sort of bigger scale model that's going to be something that is plausibly implementable. I mean, suppose there are 12 different kinds of workplaces, and suppose you've actually got really good data and you've worked out that actually it would make sense to close 6 of these kinds of workplace and leave the other 6 open. So, but if that is unlikely to make sense to the kind of people you're asking to follow this. So
that's exactly what we've done though, right? I mean, that's exactly what we've done in Scotland. You know, some occupations are allowed to work, some aren't. And coming up with a rational explanation of why do-it-yourself shops are open and garden centres aren't is pretty hard, really.
Yeah.
I mean,
well, but then it becomes very much a matter of trust. You know, if you've got the public on your side, they will assume that someone has worked it out. I mean,
sure, but if they haven't worked it out, then what? Like, I mean, so what? I mean,
well, I think what I'm saying is it doesn't matter whether they've worked it out. They might actually have it wrong. It may be that the garden centres should be shut and the other ones open, or vice versa. You know, whoever's worked this out may have got it wrong. But if you've got trust in your side, that which presumably comes from, well, how do you build up trust?
So one of the smartest epi modelers, who's very data driven, that I work with here at Yale a bit, said to me early on, he's like, I'm not interested in compliance with policies. I'm interested in reducing cases. And I think that this is actually like what reduces cases. And I actually think this is, part of the challenge, which is that if policies are not the cause of reduction of cases, then why have and if you don't have compliance, and if you don't understand the behavioral responses, but more importantly, like the question that isn't being asked in most of the epi literature is reducing cases even the right measure?
Yeah.
Right. And like this was the point that Jude and I made early on, which is it seems like there are certain interventions that might actually do a good job reducing cases, but would probably also could also increase deaths. Right. And the example we found is like closing schools. And if you close schools without providing childcare for healthcare workers, while you might reduce death or you might reduce cases, you could reduce the conditional on the remaining cases could die at a sufficiently higher rate that you actually wind up with a net increase in death. And your healthcare workforce doesn't have to be that good at saving lives for that to happen. Based on I think these are some of the challenges that the epi models are designed to model cases, and everything else is a transformation on, they're linear transformations on infection for the most part, out of the main epi models, the infectious disease models. Now there are public health modelers doing things like queuing models. They're actually looking at like survival in the hospital conditional on like labor force and whatnot. But those are not usually integrated into the infectious disease models.
Eli, maybe the two things we could do to reflect the interesting point that Dennis has made. One of them we've already done, which is talk about social preferences. So we've already got that in the cost-benefit analysis section where we talk about the value of a statistical life, but we could kind of beef that up a bit. I could do that. The other thing is to maybe in the modeling section to say, okay, trust may be an important factor determining how successful a policy is. But economists don't have much to say about how trust evolves over time, conditional on the policy you're implementing. We can talk about ideas of social capital, and investing in social capital in a very general sense might be a good way of accumulating trust. But we don't have anything specific to say about how that happens or how that should happen in the precise context of a pandemic. Would that, and maybe Dave could talk about that social capital issue in his prevention section. Would that make sense?
Yeah, maybe. I mean, I guess I'm also wondering what the empirical evidence for that actually is. I mean, I feel like that's a lot of Monday morning quarterback. Like, so we have this expression in the US called Monday morning quarterback. I just realized that's not going to work on this call. Which is the quarterback in American football who leads the team, and the game is played on Sunday. So the Monday morning quarterback is the person who's second guessing all the decisions for the team that lost. Okay. While I would say that countries like the US and the UK that haven't done particularly well might not have high levels of trust, I'm not sure that we have a whole lot. I'm not sure that we can actually say that that's causal, or that it just spuriously works out that way.
No, there's some evidence that relates it to the management of common property resources and to pro-environmental behavior like household recycling, but I don't know of any evidence that relates it to how well behaved people are in a pandemic. Yeah,
and I think that, like, if you look at what's going on in the UK right now, I mean, some of that's just driven by pathogen evolution, right? And who knows, right? And it always seemed to me that, and maybe it's because I'm not in the UK, but it always seemed like the one piece of government that people in the UK had like reasonable faith in was the NHS. So, I would question, is that not true? Or is that like...
Well, I think you have to draw a line between Scotland and the UK.
Sorry.
We're managing things in a pretty different way, but as a general statement, you're right.
So, I mean, I think that that's like part of the challenge too with a statement like that is that like I think that that's just part of the challenge. That it's a popular story, just like the story that people are irrational is a popular story, and there's these behavioral quirks. But the reality is that like you can explain most behavior like 70 to 80% with standard neoclassical economics, and you can find behavioral quirks, and they might matter because the tails might matter, but that's probably not the place to start. Do you not agree with that, Nick?
Well, I'm just writing a paper with a couple of behavioral scientists on behavioral cost-benefit analysis. So I think they might want to argue with your 70% of behavior, but as a broad statement, I'd agree with it.
Okay, I might have the number. That's Gernot Wagner says it's like 70 some odd percent. I don't know. Like I'd have to look back at his evidence for that.
I'm not sure these guys got any evidence either, but Liam Delaney, he just took over the behavioral science unit at London School of Economics. So he knows the field very well. But I think his point would be, and I'm not sure we need to talk about this, but if you think about all these so-called anomalies, there aren't very many of them that actually matter a lot. There's some that matter a little bit, but the ones that matter a lot aren't very many in number. So default effects matter a lot, for sure.
Yep.
Loss gain asymmetries probably matter a lot, but things like framing effects, they don't matter much at all, really. You know, you could probably publish a paper on one, lots of people do, but at the moment,
I think you can trick people into making them matter, but not in sort of situations that people understand.
And there's enormous amounts of publication bias on how big those effect sizes are in the literature. So,
yeah, have you seen Paul Ferraro has a paper on that?
We're getting away from our core discussion, although it's very interesting. It's much more interesting than pandemics, actually. As interesting as pandemics. I guess in the US, you must have enormous regional variation in how the situation is managed, or is that not true?
Yeah, we do. And I mean, I think the US, it's been particularly bad. But the other thing that I was pointing out in one of these calls, going back to the question of modeling, is like the national level models don't make any sense. You know, if you compare a national level model for the US to the UK or to England, let me be a little more precise, to England, like you're modeling at the US, there are, I don't know, N different epidemics going on that they're not all synchronized. And so Jude Bam and I have a model, a really simple model that can basically produce you can easily produce arbitrary pandemic patterns. And it just comes out of the fact that if you have pandemic waves that are out of sync and you start aggregating them differently, so they're just taking places on not a fully connected graph, the aggregate pattern won't look like the well-behaved epi curve. It can look it can look like you've got multiple waves. It can look like you get up and get a ridge and run along a ridge. It can do all sorts of things. Just because the epidemic's not happening at the same pace and the same speed everywhere. And so I think that like all of these attempts to model national epidemics is also kind of foolish in that sense. We did some work early on, and the collaborators who was doing this with disappeared, and we didn't have access to the raw data. But using the cell phone data for the New York City area, and if we broke it up and used like the connectivity between regions, like our ability to actually fit the data with a simple model went up, you know, it went from like 20% to like 90% just by like treating what was going on in Long Island and New York City and Connecticut and New Jersey slightly differently and looking at the actual flow patterns when things were shut down. And like we were getting the delays about right, and they were emergent out of the model. So I mean, that's, I guess my other concern, again, this gets back to like what's stable in these models. What are parameters that are actually not time varying, and what can we, and I think that's the challenge, right? And that's where the behavior really matters, is in like trying to get to things that are not time varying, that are actually true parameters for the question at hand, and separating out this notion of selection versus adaptive behavior and getting the data generating mechanism correct. If you want to have policies that are created, that's why I started off with the paraphrasing of the Lucas critique, because I mean, I really think it super applies in epidemiology.
Yeah.
Sorry, we're rambling again.
No, we thought.
That means we're done, Kira.
One thing I was going to ask about was the sort of the long-term, short-term things. I mean, some of this stuff about, you know, a lot of the analysis seems to be rather, I mean, pretty much for an endemic state, rather than envisaging that we might actually have a strategy that drives the disease down to a low level or even eliminates it. I guess you know, if you take your example with two different strategies, one of which was reducing cases but actually increasing deaths or whatever, you know, my question would be, but which of them is actually driving the level of the disease down over time? Of course, they could be paired off, so they're both leaving it exactly as it is. I mean, I think that, I mean, obviously, I suppose we're all hoping that the vaccine will come and save us, but modulo problems with new strains evolving that keep nipping around the vaccine. But it's still certainly the UK national policy just does tend to seem pretty short term, where you just try and get the pressure off the hospitals so they've got enough ICU spaces to cope, and you tell everyone you've got R below 1, and everyone says, "Oh, that's wonderful," and you relax your grip a bit, and before you know, you're into the next cycle, rather than, you know, whereas I think a few countries have, perhaps with easier circumstances, have set an objective of just carrying on reducing until the disease is pretty much gone. But I mean, it's a thought experiment. Do you think some of the United States, some of the states that are doing better, could actually get rid of the disease if they could just close their borders? Pessimism, right?
Well, so there's a paper by Barrett and Hoyle, I think it's a 2007 paper, where they look at like optimal disease eradication and they fit it to smallpox and polio. And they basically make the argument, I believe, if I remember correctly, that it, like, polio is a tough call on whether or not you should make the investment to eradicate it. For something like SARS or flu, or COVID-19, I think that these are like, unless they're going to die out on their own, they're here to stay, right? I mean, we're going to be living with this forever, and you know, it might displace flu, right? Like we deal with the flu. The flu kills lots of people every year. But what's happened with virus, I don't know what will happen. What's happened with viruses in the past, right? Like this, is we will get a level of immunity that's rolling, so that you'll get a disconnected network of infectious susceptible contacts. So fewer people will get infected. There'll be better treatment in the hospital, right? And chances are the pathogen will evolve to be more easily spread and less impactful, because that's what pathogens tend to do, right? It's not in the pathogen's best interest to like have its host isolated quickly, or kill its host. So, I mean, and I think that the idea of like driving this out, sure, like if you're New Zealand and you don't have much of it and you can kind of keep it out and keep your economy, your autarkic economy kind of running smoothly, fine. But for anywhere that's like well integrated with easy movement of people in and out, it's going to reemerge, right? And I think that that's the bit here that we can be pessimistic about the short run or the long run, but I think it's not really pessimism as much as it's like we'll be dealing with this and people will get maybe an annual COVID shot. Who knows? But I think from what I understand there were a bunch of papers in Science this week about the new variants and new strains and vaccine, and the gist of them is everyone calm down. This is not that. This is what we expect to happen, and it's pretty easy to tweak these vaccines for these new variants. Like it's not like I don't know that. Yeah, I mean, I have more of this idea that we have a market for lemons in the information space right now, and that's what's actually going on, and we're all falling victim to it. That there's a really big incentive in the media and in the press to create echo chambers to keep you hooked into and to believe that everyone else is lying, so that you keep clicking on their ads. And I see that AER paper coming out, Nick, in the next couple of years, but I think this is like a market. I think this is like Akerlof's market for lemons in like media and information.
Yeah, it's a nice idea.
And so I think it's just hard. Even as scientists, I think it's hard. And I start most of my COVID-19 talks with like, anyone who speaks with great confidence hasn't really been paying attention. So.
Yeah.
Very good.
So I think we have a plan for going forward next. So the ball's in my court. I'll read through the bits and give indications about how and what changes might need to be made, and then pass it to you, Nick. Was that what we said? And then you're going to poke Dave about with exactly what we want from him in terms of like numbers of sentences and on what.
Poke in the nicest possible way.
Poke in a nice way. A friendly hello to David.
I'm happy to poke him. I've done it before.
Well, I'm going to see. I think I'll talk to him later today. So he's also in this conference I've been in this week. So I think that's the other thing he's been focusing maybe on that.
Well, you could just update him then, Eli, anyway, if that would be okay with you.
Yeah, I'll try and do that.
Okay.
Cool. Thanks, guys. Have a nice rest of the day.
Yeah. See you now.
Take care.
Bye.
Bye.
Bye-bye.